15 facts on HPV vaccine. HPV vaccine is unique as it is a vaccine that prevents cancer. This vaccine, which is otherwise known as cervical cancer vaccine, protects against cervix cancer in uterus in females. Not only that, but also it safeguards males from various other cancers. Furthermore, HPV vaccine averts genital warts as well. Then why people are avoiding to take this vaccine? Why parents are backing away to allow their kids to take HPV vaccine? This is due to lack of proper knowledge about the same. In this video, we will address few queries related to HPV vaccine. 15 frequently asked questions about HPV vaccines and their answers. What is the ideal age of HPV vaccination? And what is the maximum age up to which HPV vaccine can be given? Why HPV vaccine should be given at an early age? Is it only for females or males should take this vaccine too? Can a pregnant woman take HPV vaccine? Is HPV vaccine safe? When to give it and what is its schedule? If a person has HIV infection, then can he take HPV vaccine? And if so, what is the schedule? Suppose HPV vaccination is started, but the schedule is interrupted in between. What to do in such case? What is cervical cancer screening? And is that screening required for a person which is already HPV vaccinated? And many more such questions. So let's get started. What is the ideal age to give HPV vaccine? The recommended age for vaccinating with HPV is between 9 to 14 years of age as per CDC, maximum age being 45 years. Why to vaccinate at so early age? Parents often ask why there is any need at all to immunize this early. The answer to this is immunity produced in kids around this time is way better than in later age. Also, vaccinating in early age protects a person ahead of first exposure with HPV virus. Is HPV vaccine recommended in males too? As per CDC and WHO, all kids around 11 to 12 years of age or at least between 9 to 14 years of age should be given shots of HPV vaccine, applicable for both females as well as males. Evidently, HPV vaccine prevents anogenital and mouth cancers as well as warts in men. Besides, it prevents transmission of humanpapilloma virus in community. Thereby, it brings down the burden of disease related to HPV infection in entire community. However, in developing countries like India, this vaccine is mandatory for females and there is no such clear guideline for males even now. What is the schedule of HPV vaccine? It is a 2-dose or a 3-dose schedule relative to which type of HPV vaccine is used and the age of the person taking the vaccine. 2-dose schedule. First dose on day 0, that is today. Second dose at 6 or 12 months. 3-dose schedule. First dose at day 0, that is today. Second dose after 1 month or at 2 months. Third dose at 6 months after taking the first dose. Suppose HPV vaccination has started but schedule is interrupted in between and then child is again brought for vaccination. Is it imperative to repeat whole schedule? Answer to this is, in this case there is no need to repeat the schedule from beginning. Vaccination schedule is followed from where it is left. How much minimum gap should be between 2 doses in a 2-dose schedule? Here, the minimum gap between first and second dose must be 5 months. What if second dose is given within 5 months of first in a 2-dose schedule? In such cases, need to redo second dose. This should be given after completing 5 months from the first dose. How much minimum interval should be between the doses in a 3-dose schedule? In a 3-dose schedule, the minimum gap between first and second dose is 1 month and the minimum interval between second and third dose is 3 months. Further, take care that third dose is given no less than 5 months of the first dose. If a person takes HPV vaccine before 15th birthday and second dose is waiting, and then the person comes after few years, what to do in such scenario? If the first vaccine is given on or after 15th birthday, then 3 doses schedule of HPV vaccination is followed. And if first vaccine is given before the 15th birthday, then 2 dose schedule is followed. Thus, in this case, it is a 2 dose schedule. As first dose is already given more than 5 months back, only second dose is enough. This shot is given without any further lingering. Can Tdap be given along with HPV vaccine at the same schedule? Yes, Tdap can be given at same setting but in distinct site. Is HPV vaccine safe? There are mild side effects with HPV vaccine, same as any other vaccines. Pain and swelling at the site of injection and body pain are few to name. Adolescents complain of giddiness and fainting after taking this vaccine. So a person should be kept for observation for 15 to 20 minutes at least post vaccination. It is better to inject this vaccine in lying down or in reclined position. Can a pregnant woman take HPV vaccine? No, a pregnant woman best not to take HPV vaccine. It is because this vaccine is not studied in detail in human pregnancy. However, if a person is accidentally given HPV vaccine during pregnancy, it is not a criteria for termination. Pregnancy should still be continued. Importance of cervical cancer screening. Cervical cancer screening is exceedingly important in women after certain age. A pap smear sample is taken from cervix and examined under microscope to see for any abnormal looking cell. This is to track down cervix cancer and precancerous state yearly. Also, there are methods to detect human papilloma virus from the sample. Point to note here is that after a woman develops HPV infection or cancer or precancer, vaccine cannot reverse the path. Is it still required to screen for cervical cancer if a person is already vaccinated? It is absolutely necessary to screen for cervical cancer even if a person is vaccinated. Vaccination scales down the chances of developing cancer by manyfold. However, regular pap smear screening is still required in a woman as per guideline. If a child has HIV infection, then what should be the schedule for vaccination? In this scenario, adhere to 3-dose schedule of HPV vaccine for the kid. In immunocompromised states like HIV or immunosuppressive therapies, 2 doses fail to generate satisfactory immunity. Hence, 3 doses are required. Summary. Question about HPV vaccines are tons. And why not? It is a vaccine which is still evolving. There are concurrent researches and developments going on about HPV vaccine each passing day. Here we spoke about the most common queries related to HPV vaccine. If you have got more queries regarding HPV vaccine, then comment below. Thank you for watching this video. Share this video maximum with others and aware them too. Do subscribe to Pediatric Simplified. This video is for educational purpose only. For medical advice, kindly consult a physician.